So today we're thrilled to have Dr. Yousuf, a leading naturopathic doctor specializing in men's sexual wellness and hormone balancing. Dr. Yousuf has a passion for helping men reclaim their energy and confidence. He combines cutting-edge science with holistic principles to restore the body's natural balance. From tackling low libido to optimizing overall health, his overall approach is about addressing root causes with personalized natural solutions. You can learn more about his work at dryousufnd.com. That's dryousufnd.com. So I call you Dr. You.
Yeah.
I don't know if anybody else has made that connection yet, but I call you Dr. You because you were the first doctor who I ever met, who I ever had a relationship with as a patient physician who really made my health feel about me. Dr. You's all about you. Not you, but you as the patient. So is that something that you've heard your patients kind of tell you, that you've made them feel, I don't want to say special, but you've really focused in on what their root cause problems are and how to fix them?
Yeah, I I appreciate that. I would say it's not uncommon for a patient to show up into my practice and at the end say, hey, I didn't realize we're going to be unpacking so much about who I am. And a big part of the reason why I practice the way I do is I focus on the whole human. I don't just focus on individual aspects of that person. Because the philosophy behind the type of medicine that I practice and the way that I practice is that we can't look at individual systems because each individual system is directly linked to the whole person. And that's linked to things like hormones and physiological processes and digestion and metabolic processes, but that also layers into like psychodynamics and whatnot. So I'd say, kind of, which I secretly love, and I think I wish I was a therapist. But a lot of my parents
are a therapist.
Well,
a
lot
bit.
of them call me their therapist,
right?
Which I really love. I actually love.
I don't really believe in therapy, but if I were to have a therapist, it would be somebody like you.
Oh, thank you.
And so I don't really believe that therapy is very useful. I think it can actually be quite harmful, and I'm sure you've seen cases of that as well. So how do you feel like naturopathy and allopathy complement each other? Do they antagonize each other? Is there some complement that you see that works really well? Is there some way that they antagonize each other?
I mean, it's a great layered and very nuanced question. My practice is based out of Nutrichem. We're a compounding pharmacy. I'm not an anti-pharm naturopath. I'm a results-driven naturopathic doctor. And what that means is that my passion is to restore the natural function of the human body. And I do that using natural substances. Those are botanicals, herbs, vitamins. I have my training in pelvic floor, so there's also structural components too that can create misalignment. However, it's also important to understand that each modality, each profession has kind of a line. There's a threshold that our medicine will approach. And if we're not getting the results, that the intended result or the patient's result, I don't shy away from engaging their family doctor. I have a nurse practitioner too that I work with, that I refer to within my practice. Because at the end of the day, I'm more of a results-driven practitioner. So are there certain, medications that I don't love? Yes. Are there certain medications that come in that I'm like, okay, we got to get you off this. Let's really start focusing in on recalibrating your body.
So I found that in the natural world, I consider Focuswave to be somewhat of a natural-driven clinic, that we don't get the props from allopaths as much as vice versa. As much as we, allopaths tend to kind of, in my experience, have belittled the naturopathic profession, considered it kind of, holistic bullshit. And I couldn't disagree more, especially based on my personal experience. My personal experience with you was I had a skin condition that I went to multiple dermatologists who could not fix, or who had, prescribed me steroid, and there's my coffee machine. Just automatically going off. Yeah. So my skin condition was relatively simple, but both dermatologists provided me with the exact wrong solution. Whereas you took a much different approach to it and fixed it in like 2 weeks. I mean, I was dealing with this for years and years and years, and I had never been to a naturopath before, and so my experience was, the allopaths don't really know. They're not really keeping up with what's going on, and so, look, if my heart explodes or my brain, clogs up or whatever, I'm going to have to go to the hospital and see an allopath. But for my day-to-day lifestyle stuff, I'm going to see a naturopath. And so I found that the allopaths just, unfortunately, they just don't keep up. They don't have time, right? Because you spend, 45 minutes to an hour with a patient, whereas they have 8 minutes. And I think that's where the biggest gulf lies, is that if those guys had the time, maybe they would be able to get to the bottom of things a little bit better.
And I think it's multifactorial. It's time for sure. It's also training, and it's also a mindset. So I think that, not all clinicians are the same. Not all naturopaths are the same. Not all physios, not all MD specialists. We all are individual people who show up with our own individualized approach within a standard of care, of course. I don't think medical doctors become medical doctors to not offer amazing care to their patients. Do I? I think there is intention to choosing this profession. It's like the process to becoming a medical doctor is really grueling, especially the residency program. For me, I think there's a mindset and a curiosity. There are lots of family doctors and specialists who are still curious about their patients and offering really good care. I find that those individuals I have excellent working relationships with, where we cross-refer. I write referral letters for further investigations for things that fall outside of my scope, and they work in a real collaborative setting. It's really exciting work for me as a clinician, and my patients are getting awesome results.
So you see complementary.
In some cases, not all. There are cases where, and we have a long history of this as naturopaths, it's shifting quickly, where it's, it becomes really territorial. I've had patients in the past who said, well, if you're going to see a naturopathic doctor as your primary care provider, then I'm going to discharge you from my practice. And there have been those tactics. Now it's much less. I think there's a lot more understanding as to what it is that we do.
So you're seeing more complementary acceptance from the allopathic side than before, even just in the last 5-10 years.
Yeah, very like it like even within the last year, 2 years, 3 years, it's gradually it's very rapidly changing.
What do you think drove that? Like, what is the driving? Are allopaths realizing that turning people into pill factories is not a good idea?
I think that it's education. So I was the secretary treasurer, and I currently am just a board director for the Ontario Association of Naturopathic Doctors. And we're the largest of our association, and we do a lot of advocacy in Ontario to promote our profession. And there's a lot of education that we lead, a lot of interprofessional relationships to really explain how we fit into healthcare. And I think that that's been making a lot of movement forward. I think there's also, the curriculum for naturopaths has drastically evolved over the last 15, 20 years to become a very evidence-based focused practice, but also maintaining the integrity of the healing power of nature, which is one of our core principles. So I think it's a profession that's in growth and in movement, and it's slowly being embraced. Do we have our roadblocks? Yes, for sure. We definitely have our roadblocks, but at the end of the day, I can't remember the stat, but 40%, might be 60% of Ontarians see naturopaths. So it's not like,
that high.
It's really high. It's higher than you think.
And in the States, is it similar, or?
I'm not sure, because in the U.S. they were a little bit slower to regulate naturopathic doctors statewide.
Insurance coverages are excellent for naturopaths now, at least in Ontario.
Yeah.
Yeah.
It's getting better. There's certain, and there's certain employers where it's actually quite, they would have full coverage for the year for ongoing treatments. Some employers less, some employers more. It depends on the philosophy of the organization.
So the problem I had, in the patients that I deal with, and we'll talk about men's sexual health, and that's all of our patients and a large percentage of yours too, I believe, is the pill factory. Is that a lot of these guys come in, they're taking multiple anti-anxiety pills, SSRIs, benzodiazepines, they're taking metformin, diabetes. I know we'll talk about that as well, because I know you I don't want to say you struggle with them, but you don't generally take diabetic patients, right? Is that still correct?
No, I fully take diabetic patients.
Okay.
Yeah.
I thought my remember. Okay, but so we have patients who come in and they're taking prescription drug A, and it's just say Viagra, and it's causing them a backache. So instead of switching them or removing the Viagra from their pill list, the doctor then puts them on Robaxisat, another prescription drug to combat the side effect from the first prescription drug. This is like, to me, it's just, as I'm not a medical professional, I'm not a doctor, but to me, this is like insanity. And so how do you de-prescribe guys? Is that something that's part of your practice?
Yeah, and I have a funny story about my dad. We were talking about my dad earlier, and my dad's this 85-year-old Indo-Pakistani guy who believes that his food, full of all of these spices, is healthy. And my response to that is, well, within the South Asian community, why are diabetes, high blood pressure, and cholesterol the highest? So he sat me down. He goes, "Oh, Yousuf, my diabetes is getting a little bit worse. My cholesterol is getting a little bit worse. I'm on all of these medications. What do I do?" I said, "Okay, let's figure this out." After bridge, he goes, he's part of all these, he has daily bridge groups all over the place, and he goes, "After bridge, are you going to keep going to Swiss Chalet?" And he's like, "Well, of course." I said, "Okay, are you willing to cut back?" He goes, "No, no, no." And I said, "Okay, well, maybe these pharmaceuticals are the best option for you, considering that you're not open to making any sustainable changes." Because at the end of the day, when we look at ED, when we look at erectile dysfunction, when we look at Peyronie's, when we look at, those two in particular, in a male body, it's a sign of metabolic syndrome, of cardiovascular risk. In my medicine, in the way that I practice, we take a look at the whole human and we start to uncover and unpack what are driving these things. Do they smoke? Do they eat fast food? Are they exercising? And then to support them along the way, we use natural herbs. So is polypharm something that shows up in my practice? All the time. It's very prevalent. But as like a licensed practitioner, and the way that I practice is we go through how did they arrive at that point, and we start to peel it back. And the patients that are successful with me are the patients that sit there and say, "Okay, let's unpack this and work through this. I'm motivated to make a change in my life." The ones that are that kind of, it's funny, there's a subsect of men that come in and they want that instant fix. They want the Viagra, they want Cialis, they want an erection, a hard, full erection they want to perform. And they don't want to hear or work through any of those risk factors. They just want the result. And those guys, that's fine. You keep doing that. But inevitably, 2-3 years later, they come knocking on my door saying, "Hey, look, Dr. Yousuf, something else popped up. Can we deal with that?" And then the fear starts to set in, and then
the compliance. I mean, that kind of leads me to compliance. And if you're compliant, if you listen, like my experience with you was when I came to you and I told you I was having, every night my stomach was kind of aching and I was farting every night and just relentlessly. Right. And you said to me, "Drew, just candida cleanse." And I said, "What's that?" And you said, "No gluten, no sugar, no dairy, no alcohol, no caffeine." I was like, "Fuck that, I'm not doing that." And you said, "Fine, just when you get the courage to do it, just start. Don't plan, just start." That's really the motto I've been kind of following in many ways. So compliance, I complied. I did what you told me to. I took some I forget which
Garlic pills.
garlic pills, Candida Clear. That's the garlic pill, yeah, and something else. And I did it for 35 days. Fucking reset my gut. It really did. Reset my gut. Lost 20 pounds, 3 inches off my waist. Did I feel better? Not really. It solved a lot of my symptoms, but it goes back to compliance. If your patients aren't listening to you and doing what you suggest, then the chance for success is really low. Whether you're a naturopath or a physiotherapist or a sexologist, doesn't matter. So how do you find like you have to somewhat hypnotize your patients a little bit? Is that part of the practice at all, to comply?
It's funny. It's a great question. And I would say,
Because I think you hypnotized me a little bit. Like by telling me like just whatever, Drew, just you'll do it when you do it or you won't, which is kind of like it's like a backhanded, it's like an open threat almost. Like you're gonna do it and you're gonna succeed, or you're not and you're gonna fail. And I just remember being halfway through and feeling like that fucking guy just hypnotized me into doing this, which I've never done before. I've never woken up and not had coffee in 30 years, and then I did it. And so so back to that question, which was, how do you get these guys to comply?
Yeah, and so, in my practice, in my evolution as a practitioner, there came a point where I was actually getting frustrated with compliance. Compliance, and specifically in men, it's either 100% or it's zero. There's no real middle ground. And I was getting really frustrated, and I would take it personally. And I reached a point where I thought, you know what? This has nothing to do with me. This has to do with the other person on the table, and what do they need? Like, what needs are being that I'm missing? So, my practice philosophy is I'm going to meet you halfway at the table. I'm going to come with my information, my research, my protocols, and I'm going to present them to you, and then you need to buy in. It's not my job to actually. Well, I like that you thought that I hypnotized you, so I like that. But
you did.
But it's also interesting because the idea is like, well, I'm not going to take accountability for your process, but I'm going to give you every tool I can find. I'm going to augment whatever protocols I have to make sure they work with where you're at in life, and I'm going to work with you. I'm your partner through this process, 100%. But I need them to tell me where they're at, and I will meet them where they're at.
So
that is.
what percentage of patients would you say comply? I mean,
I'd say I've got pretty good compliance with my protocols.
But it's not 100%. I mean, no. Over time you will start to see patients fall out and fade away or whatever. So it's not 100%, right?
I would say it's high. Like I would say, and patients who stay with me for years. Like I have a large patient base, percentage of my patient base had been with me since I moved to Ottawa, which I love because I get to see their evolution. But there are those who don't. There are those who come in, they do an initial, they'll see me 1 or 2, maybe 3 more times, and then they will kind of say, okay, I think I'm good, and that's fine too.
And do you follow up with those guys, or do they? I mean, you follow
inevitably they like, oddly enough, they come back a few years later. They're just, at the end of the day, when we're ready to make these really fundamental, deep changes in our life, it as you had said earlier, we have to be in the right mindset for it to happen.
So I always call you Ottawa's only men's sexual health naturopath. I don't know if that's quite accurate, but it's whatever. I'm still rolling with that.
I still like it.
Yeah. So what is the most common men's sexual health issue that you see? Is it ED? Is it relationship issues? Like, what is the most common problem that you see, and what is the where is the imbalance in those guys?
Yeah. So, what brings a guy in? There's many different things. There's sexual health, so ED, any prostate related issues, pelvic pain, overactive bladder, would be from the sexual health side. Libido, sexual performance anxiety. I have my training in sex therapy through the University of Guelph, so I have my certification through them. And so it's exploring different facets of their sexual reproductive health. But I also have men coming in for chronic gut issues. I got guys coming in for cardiovascular risk, metabolic syndrome. What's interesting is that when we look at the whole human, we look at the guy and we look at all the aspects. Guys who are coming in for ED, guys who are coming in for prostate related issues, inevitably there's a whole subsect of other factors that have to be worked on. I know guys come to see you for shockwave, for vasodilation. Excellent, really good. From my perspective, we have to, get their sexual function up, because that plays a huge role in the psychodynamics of that individual and self-esteem. But what I like to do is take that piece and then say, well, what else can we work on? There must be something cardiovascular. There may be something metabolic, and there might be something that's psychogenic in nature. So I work with them to unpack all of these things.
So is there a protocol that you kind of follow that you've developed over time that a checklist of sorts that you kind of go through? And is there one thing that is your always go to, like you have to check this and know this for a certain type of patient? Like for like an ED type patient,
Yeah.
if you suspect, say, vasculogenic ED, is there something that you can do to help them?
I mean, you have the access to the same study, and you reference it for Peyronie's, and that adult onset Peyronie's in the absence of a trauma is directly related to cardiovascular risk, and there's a risk of a cardiovascular event in 2 to 3 years later, is what the stats are saying. Is there like a modality? It's honestly, it's super individual.
Blood work, though, right? I mean, like
We do blood work.
Yeah.
Oh yeah. So I do. Yeah. So what's different for me from a lot of family doctors, some urologists and endocrinologists, is I test everything. So it's an entry point, of course. There's about 8 pages of blood work on my standard male comprehensive panel. We look at everything.
8 pages.
It's about 7 or 8 pages.
Because most guys who come in, they say, I did my blood work. I was like, did they check your free and your testosterone, free and total testosterone? Did they check your cortisol, your prolactin, all these different levels? They say no, or I don't know. So they're not really checking them unless you ask, right?
And even if you ask, the answer tends to be no.
Right.
So within my panel, I have luteinizing hormone free total. I check estradiol to make sure that aromatase isn't overactive. Sex hormone binding globulin, again, for insulin resistance. And liver health. What else is my cortisol AM is in there. Vitamin D deficiency. HSCRP for chronic inflammation. Yeah, the list goes on.
What does that cost, and is that an out-of-pocket expense for almost most everybody? And is that something that in Canada, because we're so used to free healthcare, that people are not willing to pay for that?
The cost is for my panel in its current iteration, because I'm about to revamp it, is $310. It's $310. I don't get very many patients who are concerned about the cost of it, because they want results. They're like, hey, look, I have seen every practitioner under the sun, and no one, like your story, no one's answering my questions or really looking under the hood of the car at the full engine. So it's time to invest in my health. Yeah.
8 minutes with an MD is not going to buy you what 45 minutes to an hour with a full blood panel will with somebody like you.
A full blood panel, a full physical. Like, it's like, let's really figure this out together. And then not only that, we go through the blood work line by line by line. We go through what, like, are you outside a parameter? And then are you within the optimal zone? Because the idea to build longevity is to draw those numbers into the optimal zone.
Mm-hmm. So just to go back to Peyronie's disease, because you do see patients who come in with Peyronie's disease. It's relatively underreported in my experience. And one of the things I noticed about PD is that people who have PD tend to also be on the scale for depression and anxiety, have severe issues with depression. If you have PD, you're much more likely to have depression. So as a therapist, is that something that how do you treat somebody like that who is struggling with Peyronie's disease, curved or bent penis, pain during erection? And is that something that you can, how would you treat that at NutriChem?
Yeah, so for me, I'd say premature ejaculation is linked to like a lower serotonin level, and then that's linked to, so serotonin is what makes us happy. So in premature ejaculation, I do dive into an individual's kind of state of mind. In Peyronie's, to me, it's more on the cardiovascular, so it could be trauma based. There are topicals that I can prescribe to help break, and manual therapies through pelvic floor training to help break through the scar tissue, but actually shockwave is a better option.
And traction devices like these, the Peyronie Master and the Restrex, do you ever look at those, or have you ever considered?
Yeah, but for Peyronie's, actually, I refer to you. And then what I do from my perspective is we work on cardiovascular risk reduction, as well as we check fasting insulin to make sure there's no pre-diabetes in the picture. But yeah.
You know what I found is that a lot of patients, so for PD, you know, I'd say in my experience when we talk to PD patients every day, about 75% of them don't know how it happened. Now, they may not be telling the truth, or they really don't know how it happened, but about a quarter of them are, oh, I broke my dick having sex, or I roughly masturbated, or whatever it was. They know for sure when and where it happened. But about 3/4 of them have no idea. And I speculate that and again, there's no real science behind this, but it's based on my speculation, is that if you have normal and healthy erectile function, you're getting 3 to 5 erections every night. All it takes is turning over on your boner the wrong way during sleep, during a dream, boom, Peyronie's disease. If you're the kind of person who heals maybe somewhat abnormally, or you're more prone to scar tissue, that's it. There's your Peyronie's disease. And that's, 10% of men over the course of their lives have this condition. Do you see any validity in that? Because
I would say with my patient base, it was either gradual onset, which is to cardiovascular disease, like early onset for cardiovascular, or there's a direct trauma. I do have men who come in who which is really fascinating, and this attests to the fact that there isn't a lot of information out there for men's health, which is why we're both in this space. But I have men who come in for ED. I do a physical only to reveal that they actually have Peyronie's, and that the curvature of their penis decreases blood flow. So wherever the trauma was, or the scar tissue, decreases blood flow to the rest of the penis. And so as a result, they come in saying, hey, look, I got ED, but the reality is it's scar tissue as a result of Peyronie's.
They got PD, which led to ED.
Yeah, or it is Peyronie's that's leading to lack of blood flow. So once the scar tissue is resolved, they get full erections again. And then there's also pain during intercourse, even if Peyronie's is mild, or hard flaccid is something else that I treat as well. It's just where the shape of the penis is somehow changed, and it makes intercourse sex difficult.
Yeah, it's a real tough condition.
And a lot of guys suffer in silence.
Well, that's what I'm saying. There's the recent study. There was a 25-year cohort study that showed that men with Peyronie's disease are much more likely to have depression.
Yeah,
and
that I see it that way.
Yeah,
for sure, I see it that way, because we have to also remember, and this is why we're both in this kind of sexual health space, is our sexual self plays such, specifically as men, plays such an integral role in who we are for some men, not all men. And when that's lost, or when that changes, it's really difficult, because we're socialized to, and our testosterone plays a big role as well, to be these sexual I was going to say animals.
Yeah, well, we are animals, right? Sexual animals, sexual beings.
But yeah. And so when that's gone, or when that changes, there's a whole psychology in a female body, and for women. For example, menopause, it's the loss of period. And there's a whole, in my female patients, I talk about, there's this unveiling that happens. When a female loses her ability to, her fertility, and she, what I observe, moves into this next phase. And there's this kind of unveiling, and this for some women, this sense of empowerment. It's actually really amazing. In men, what happens is our testosterone just slowly declines. So it's this, we still make testosterone, but there's these really subtle changes. Andropause, which start to kick in. And it's like this mind effort, because we're like, God, my body's not showing up the way it did. And I'm trying to do what I've always done before. It's not like menopause, where it's like it's not a clear end, but it's a clear end.
Yeah.
So yeah, so our mental health plays a huge role in these changes
Yeah,
because we're physically performance driven.
it's true. And the more that we struggle with our sexual, I like to, well, I don't like to, but I call it a feedback loop. So guys come in and they're struggling with their sexual health and they're on this negative feedback loop. They're just going backwards. And they're fearful every time they want to have sex because they're afraid of what happened last time.
Mm-hmm.
And so for us, it's, you know, doing shockwave or even just talking to them, you know, in my position, just talking to them or having our nurse talk to them, you know, during treatment, get them neovascularized, get them, you know, on the right track. And then all it takes is one positive sexual experience to get them on this positive feedback loop to kind of just push away the negative feelings. Obviously, it's not enough. I mean, you still need the physical component to be working, but just getting them on a positive feedback loop from that negative feedback loop is huge.
Yeah, and every guy that comes in with a sexual health concern, a performance related concern, the first thing I say is any guy who's lost his erection once, there's a seed that gets planted, the seed of doubt, and there's this psychogenic element. We can talk ourselves out of an erection in a second, and it's important not to miss that piece, right? So, because every guy at some point will lose his erection once. Some guys don't care, some guys care more.
Yeah.
But as you're talking to, there's that feedback loop that starts to change. I want to add one thing to that, which goes to, you know, the benefits of shockwave, the benefit of, I say this with caution, Viagra and Cialis, the benefit of going through a candida cleanse. When we very quickly move and experience our body in a different space, it gives us a sense of confidence. It allows us to see, okay, my body can be strong, my body can be healed. I can start to trust my body again. And so, for example, some one of your clients comes through and they go through 6 rounds of shockwave, and all of a sudden they have like full great erections. It gives them the confidence, right?
Confidence is huge.
It's huge.
Yeah. And do you notice guys with premature ejaculation? Do you notice that they tend to they tend to be younger than your typical patients? Is that more common, or do you not see any correlation with age? I mean, the data shows that there's a slight correlation, but it can happen to anybody at any time.
I mean, it depends on what's causing it. Yeah, I would say. I mean, this is opening Pandora's box even wider, but which I love, is that, you know, in the younger generation. So we're talking about premature ejaculation in 20s, 30s. To me, has to do with neuroplasticity and pornography, and so that can either be delayed or inability to ejaculate, or premature ejaculation plays a role in, I'd say, men in their 20s, 30s that I see in my practice. I'd say PE in athletes as well as in older men is related back to pelvic floor, which I have my training certification in. And we look at the prudental nerve and nerve entrapment and nerve overstimulation. And so there's certain techniques that we walk through clinically that helps to release the nerve, and I get really good results with that. And then there's also some interesting studies, which I'd say I'm not in love with, which I mentioned before, the serotonin piece. And so for premature ejaculation, one of the therapies is to put someone on an antidepressant, on an SSRI, which I don't love that approach.
No.
In my medicine, we get the body making its serotonin on its own, or we supplement with with herbs.
So in our experience, we've seen, I'd say 50-50 between PE patients who are lifelong. They've always been premature ejaculators. And then there's the acquired PE. It just happened or developed.
Yeah.
Don't really have any data on what ages it's more likely, but is there a way that you would treat the acquired PE versus the lifelong PE differently, or is it similar?
Yeah, I mean, it's through it's through the intake. It's through the consults that we go and we kind of move through the different layers that led to where they're at. And then we get to the core of it. Was there an incident? Was there a lack of sexual activity and now a lot of sexual activity? Was there, there can be trauma, there can be weightlifting accidents. Yeah, it's multifactorial.
Yeah, it's not just
Not
cut
clear
and dry.
cut.
Yeah.
Yeah. So the difference in the medicine that I practice, going back to polypharm and going back to, as you mentioned, 8 minutes to diagnose, is that and standard of care in a way is the way that I practice is we unpack it. We have time and we work together and we unpack it together and figure out, okay, what happened here?
Got to
And
be
we fix
honest.
it.
Like that's the thing is you just have to be able to. You have to be honest with your practitioner. I mean, you have to be able to. You have to feel comfortable enough to tell them everything that's going on in your little head, and be really, really open and clear about it to have the best chance for success. Because if you're hiding things, or if you're not like we had a patient who we've shared, and had some success, minor success with him, but when he went to you, he opened up more. For some reason, I guess he wasn't really able to open up to me, and it was really struggling because we spent so much time talking, and you were able to kind of get this guy to open up. I don't know what his results were. This was relatively recently, but you have to be able to get these guys to tell you the truth, and that's hard. I mean, again, that's one of the hardest things to do. I mean, I see it often. I see guys who really spill their guts and they tell me what's going on with them, and it's really, it's empowering as a as a non-medical clinician, to have them share that and to hopefully try to put them on the right track. But if they don't, forget it, right? I mean, you're not going to fix your problem if you're not being open and honest.
And I think, healing happens when we're feeling safe. And so, not that they don't feel safe. Not all guys feel safe with me. There's like I have like a vibe and an energy that I give off. You've got one that you give off, and there'll be guys that resonate with you, and there'll be guys that resonate with me.
So frustrating.
But for me, I don't find it frustrating. I'm like, well, you got to find someone that you're aligned with. As a clinician, when someone sits across from the table, we both know, are we going to jive? We both feel it. There could be a sense where a patient of mine is sussing me out. Do I feel comfortable? What is this dynamic? What did I step into? And I'm there to, I can carry that. But there are some people who come in who are just like, I don't want to be here. I don't want to be here. I don't want to be here. And I'm like, well, why are you here?
Yeah.
I'm like, at the end of the day, like, come back when you're ready. So,
So I mean, like, in talking to patients, like I don't do the same as, I don't have the same, discussions with patients that you do. Mine is more, I'm booking them, I'm taking their money, and we're talking about a few different things. Getting personal, of course, and talking about the important things: sleep, stress, nutrition, fitness, lifestyle, relationships, all these different things. So it's.
But in our mutual people, you build a lot of trust. There's no doubt about that. And there's going to be guys that we work together with who are like, hey, just do my blood work, and I'm going to go back and talk to Drew. And then there are guys that are going to come to me, and we kind of work in that collaborative space. At the end of the day, it's all about serving the client or the patient.
So my question was you talk to these guys, we talk to these guys, but you talk to these guys sometimes for, I don't know, 30 hours a week. Like say 6 hours a day, six patients, 5 per day, whatever. What's burnout like? I mean, is that a real thing in your profession? Because I'll just say, I wanted to be a psychiatrist when I was younger. When I was
me too.
Okay, that's funny. When I was in pre-med or whatever, and I was like, okay, I'm going to be a psychiatrist. And then, I realized it's like 12 more years of school. And I'm like, fuck that, I'm not doing that. But what is burnout like? Is it a real thing? And how do you deal with it?
Yeah, it's a real thing. As a clinician, and specifically the type of medicine that I practice. And I think with maturity as a clinician, I'm better navigating, as I mentioned before, that analogy, I'm going to meet you at the table, is that I matured into a space where I don't have accountability for the deliverable. I'm there to facilitate the deliverable. And that's how we meet in the middle. But burnout's real. Yeah, for sure. It's across all professions.
Yes.
Not just mine.
I found it like even just in the times where I was spending, say, 1 hour multiple hours in one day with a patient, I found it to be completely exhausting.
Yeah.
And not demoralizing, but it was just it's taxing
I
on
love it though.
yeah,
I
yeah.
actually love it.
Yeah, that's great.
I love
You
it.
need
I'm
that.
like the moment when COVID happened, when all the lockdowns happened, I was the first clinician back in the clinic. The moment they said maybe clinicians can go in, I brought in a minute, and I was the first one doing my in-person visits. I love it. I love it. Do I have to like, check in with myself? Do I have a support team that I have for myself? For sure. I've got people that I engage with when I need whatever it is that I need.
So how do you deal with the burnout? Is you just kind of put a barrier between you and your work for a short period of
I go on
time?
vacation. I spend time in nature. I work out. Um, I do creative things. I started glass blowing a year and a half ago. Yeah, for me, the way that I look at myself is there's a creative, an intellectual, and a physical component. And when I know I'm burning out when not all three are active. When one of them starts to drop a bit, I start feeling a bit imbalanced. I'm noticing, at the end of the day, I'm like I'm on the couch. I'm tired. Yeah, and then I have to pull in my resources.
So you've had multiple careers, I guess you could say. I mean, you were architect in your former days, and
Yeah.
that didn't take, or you did it for a little bit of time. What made you go from architecture to say I'm going to take the jump into naturopathy? Was there something that specific that happened that made you go from one completely different career to another? Or
Yeah, I'll keep
just
it. I'll keep. I wanted to be a psychiatrist like you, and then I guess I was in high school, and my older sister was like, What about architecture?" And I was like, "Oh, that's kind of cool," because I was into architecture. And so then I got my degree in architectural science, and then when I got my degree, my graduation, my dad, I was like, "What do you want for your graduation present?" And he offered me something, and I said, "Actually, I just want my teacher training in yoga." Because at that point I was like playing around in yoga, and so in my 20s I dove deeply into the healing arts, into yoga, philosophy, the practice. At the same time as aggressively building my career, more in project management. I didn't stay in the creative. I went more into the business. And then I started seeing a naturopath myself. He practices very differently than I do, more in homeopathy, which is the controversial modality in my
right,
medicine,
right.
and transformed. I transformed. I reached a point in my life
How old were you
where
then? How old?
I was in my 25 to 29 because I bought my first house when I was 28 or 29 or something. I can't remember. In Toronto. Not bad.
Yeah.
And actually, this house, I fucking hated it. It was so stressful for me. I was sitting in my backyard. I'm like, the house was like half renovated, and I was having a beer, and I'm like, oh my God, I got to pay for this house. I had a car. I got to pay for my car. Like, I felt like my work owned me instead of me owning my work. And I'm like, I can't do this anymore. I'm done. And so I'm like, I'm going to become a naturopath. And I'm like, what is a naturopath? I've been seeing one for 5 years, didn't really understand what the training was. Went upstairs, searched it. I was like, yes, yes, yes. Called my contractor, said to 3 months to 3 weeks to finish the house. They finished it, sold it for a great profit. Went back. I did my pre-med, and then went back to school. Never looked back.
You in real estate, you have this very love-hate relationship with real estate, which I've noticed.
Real estate served me well.
Yeah.
And then now, yeah, I just recently sold my house, this nightmare of this house. This was the first house that I bought that was a done, I mean, you've been over, it's like
Yeah.
a done, new build house. And it was supposed to be the house I'm going to just like shut the door, travel, have space to kind of imagine different kind of working scenario things.
Easy house.
Easy house,
Yeah.
maybe build a cottage. And then the roof. I had like it was 6 months after owning the house, a little spot on my ceiling showed up. Fast forward, the whole roof had to be lifted off the house and replaced. And so when you talk about burnout, this was I'm just coming out of a really challenging 2 years.
Stressful.
Very stressful. And then I had to ask myself, well, I'm at this point again in my life. What do I want? Where am I at? What do I want? Is everything great, or do I want to like diversify? Do I want to, start looking at the way that I practice and the way that I serve my patient base.
You've been traveling a lot then, right? While your house has got an open concept roof, you were traveling a lot. What was your favorite place to visit, and is there a place that you would live outside of Canada? Is there something that's on the top of your mind right now that where you'd want to be?
Well, I mean, I grew up traveling, so it's just part of the nature of my family and my dad's work and what was important for them. So I've always traveled. It's not something that I haven't, and I love it because it's a creative space for me. I submerge myself wherever I'm at, and I feel the vibe, food, arts, everything, and I learn. So I find it's a really calm, creative space for me to kind of reflect, see how others live, reflect on how I live. Yeah.
Where?
Where have I been in the last little bit? I was in Madrid recently, which was fun. Madrid was supposed to be like, I'm like, okay, I just want to wake up, go to the gym, walk around, sit on a patio, have amazing food, swim, sleep, out dinner, and repeat for like 8 days. Yeah. I failed to remember jet lag. So I slept in through all my workouts. It was this total cluster mess of stuff. And then, so I love Spain. Spain is one of my favorite places.
Amazing food.
Food. The architecture is phenomenal. The bar scene is fun.
Wild.
Yeah. Wild, but not like in a North American wild.
Did you go to Barcelona too, or just?
I've been to Barcelona.
Yeah, I loved Barcelona,
I like Madrid a little bit more than Barcelona.
The people in Barcelona were so rude.
Yeah, they're not loving the cruise ships coming in.
Even all the I can speak Spanish. I mean, I know they don't speak traditional Spanish there. They speak Catalan. But I was like trying to speak to them in Spanish, and they were looking at me like I was some asshole. It was really, really frustrating because I'm pretty happy-go-lucky guy. I'm quite sociable, and just to be treated so rudely. And I'd lived in Europe before, so for me it was not, it was just a big shock that to experience that. When people are rude to you, it's like, for me, I just want to walk away. When you're in a place where everybody's being rude to you, it's like you have nowhere to go. You're kind of trapped.
I didn't have that experience. I haven't had that. I didn't find anyone was rude. It's just different. It's not. It's just it's more relaxed. It's less like in North America, especially in the U.S. They're really service oriented. Spain doesn't have that. Servers in a restaurant are make a salary.
Yeah,
they're not reliant on a tip. So
it's a career over there to be a server. Yes.
Yeah, but it's what's interesting is that it isn't in this like hierarchical place. It's like, you didn't give me my fork. You didn't. It's not in this exchange. It's more like, welcome to our restaurant. Enjoy our yummy food, and you're part of our kind of community. It's not less like this kind of hierarchy structures that we have here.
Did you find? I mean, I probably didn't have much time because you're on holiday. But would you assume that the sexual health of Europeans is better than, say, Westerners?
I know mine is when I'm there. I find that there's just more of a pace to a life, an appreciation. Look at, I don't know if this is legit or not. I don't even know what news source is real anymore. But what was it, in Finland? They now have a 4-day work week.
Yeah.
It's just there's an appreciation for quality of life.
Work-life balance.
And, and
you buy into that?
Yeah, fully. Yeah. Absolutely. And in my training right now, I'm in 2 trainings right now. One is with Thomas Hubel in Ancestral Trauma Collective Healing, which is for management consultants and coaches to start working through collective healing. It's a whole nother topic. And then at Rotman, I'm getting my certification as an executive coach, which is in this mindset shifting. Because I think when we talk about burnout, we talk about quality of life. Yeah. As a clinician, how do I adapt my processes to prevent these things, right? To work on the compliance, to work on the mindset. So yeah, I'm in these 2 programs right now, really in the weeds.
So you've kind of shifted your practice, or you're in the process of shifting your practice from what it currently is to, well, what are you expecting it to be, or what is the expectation in the next 5 years for you?
I don't know. So I'm a curious guy. So I don't know where it's going to take me. Right now, the idea is working with whole human, so whole human health. So in my current practice, which I love, it's really in the physiological spaces. It's working on the physical body and the different components of that, as well as the psychology of the individual too. What I don't have training and experience, but I crave, is that desire to be a psychiatrist, is in the behavioral side. And so I've had this deep yearning and curiosity. So I'm fulfilling it. I'm learning.
Yeah.
Yeah.
So, but so, I mean, the future of our industry, I don't know if say it's our industry, but the future of, say, healthcare is changing
Rapidly with AI.
rapidly with AI. So that was my question was, how are you using AI today, and what do you see as the future for healthcare with AI intertwined?
I would say I'm a terrible person to ask that question to, because I do not use
Low tech.
AI to like any. Where do I use it? I use AI to help write my referral letters, because I find it takes a 20-minute process to 3 minutes. I'm integrating AI into my charting. But by me integrating into charting is increasing how smart it is too. So in a way, it's like, how is it going to play a role into healthcare? I actually had a new patient in last week who said, hey, look, I pumped all my symptoms into ChatGPT and it diagnosed me and kicked out a treatment plan. And he goes, I did the treatment plan, but I didn't get better. And so he showed me the treatment plan, and I looked at him like, it's actually a pretty good treatment plan. Like but I'm like, but how did ChatGPT diagnose you? And
Did
so
it feed
now what
in
we're
his
doing,
blood work or something, or no?
no, it wasn't even that. It was just off of symptomology. And so I'm like, well, it sounds like what we need to do is actual laboratory testing, because not blood work in this case. It was gut related, so it was comprehensive stool testing that we ended up requisitioning. And so it's smart. So AI is fairly smart, but it's not smart enough yet. But it will be
It's getting there.
Yeah,
Maybe
it will
by the
be.
end of the. I mean, it's moving so quickly
rapidly.
between AI and. How do you think? What do you think about wearables for, measuring your data?
Right.
Is there any wearable that you recommend, or is there
I
something?
played around with a bunch. I have the Apple Watch is good, and now I'm forgetting the one that I just finished trialing.
The Whoop.
The Whoop,
Yeah.
which was wild. I was at a meditation retreat, and it told me my HRV dropped. So I'm sitting.
Your what?
My heart rate variability had dropped, which would meditation should be increasing it, and it went down. So I was questioning it a little bit. Yeah, I think these are great metrics. These are ways of us like tuning in to the subtleties in our body. I'm also a big believer in meditation. I have a regular meditation practice.
Still doing yoga?
I don't practice yoga. I weight train now, but as I approach 50, the needs of my body have shifted, so I have to start shifting too.
Sauna? Big sauna guy?
Sauna, yeah. I like here in Ottawa we have like various Nordic spas, so
Yeah.
I frequent them quite a bit.
I want to get a sauna. I really want to have one in my backyard so I can just go and sit in there for 15 minutes. It's supposed to be like a steady state cardio.
Yeah,
Just sit in
cold
there.
plunge. I'd say for the win.
Yeah, that.
Cold plunge, and here in the winter I fill up. I have an extra bathroom with a bathtub, so I fill it up with water, dump a bunch of snow to drop the temperature,
Yeah.
and sit in it every day.
You're a brave man. I struggle with the idea of it makes me. It feels like my heart's palpitating just thinking about sitting in cold water. Because even when I go to the cottage and jump in the lake and it's cold, I feel like the cold shock proteins are. I know it's helpful. I'm afraid. I'm afraid that something's going to happen to my heart. you
Well,
know?
and so when we talk about even in men's sexual health, and we talk about the anxiety, the performance anxiety, and there's like lots of people talking to this space, but when you submerge yourself into freezing cold water, your sympathetic nervous system goes into overdrive. Your fight or flight, get me out of this water.
Yes.
And within the first 10 to 15 seconds when you start, that kicks in because your body's in danger, exactly as you described. When you go into cold water, I'm worried I'm going to have a heart attack. But what cold water infusion does is it trains your brain to downregulate into the ventrovagal or parasympathetic nervous system, and you start to reset your nervous system. and how deep is this process to go from get me out of the way to I'm finding the calm in the freezing cold water within 15 seconds.
Yeah.
And the mind shift that happens from that experience is so profound. It's so empowering.
It's hugely mental, right? I mean, it's not.
I mean, there's all these physiological things too.
Yes.
But for me, it's a mindset thing.
Yeah, I think for most people, I think even for me, like just when I tell you that I'm afraid to go in there, it's because I have this, I would say, irrational fear, which is it's in my brain, it's not in my body.
Like guys with erectile dysfunction, and there's a psychogenic component.
Yeah.
There's like a part of them that's like, it's the seed that's planted that we need to pull the roots out of. So, yeah.
So, Dr. Yousuf, is there anything you want to promote? Is there anything you want to talk about? Anything we missed? Anything we should mention that we failed to? I have so many different things I want to talk to you about, but I guess I'm just going to have to make an appointment.
I would say, for me in the space that I work in, and what I'm really passionate about is participating in spaces like this, which is for men, open, transparent conversations, no topics off the table, and let's figure this out together. And so I'm just happy to be here. I mean, I'm here, I'm in Ottawa. If anyone is interested, I'm at NutriChem. I mean, they can find me through you. But at the end of the day, I think the most important thing is that we have these spaces where men can speak to what's going on for them.
Let's reduce the stigma of men's sexual health, and it's an ongoing process, and one patient at a time.
Yeah, always a pleasure, Drew.
Always a pleasure. Thank you, Dr. Yu.
Thank you.